Aloha, welcome to the Sports Medicine Clinic. My name is Dr. Joshua Peiper, and today I will be demonstrating the self-myofascial release and muscle energy techniques for the pec major and pec minor. For today's techniques, you are going to need the following tools: a lacrosse ball or ball of similar density, and a doorway or an exposed 90-degree corner so that you can get your head around it as you perform the techniques. The pec major is a muscle that attaches to the lateral border of the sternum and the inferior border of the clavicle, then travels laterally or outward, attaching to the upper arm or humerus. When pec major is dysfunctional, it will cause an internal or medial rotation of the shoulder blade or scapula, and will restrict external rotation or abduction with external rotation. The pec minor is a muscle that attaches to the coracoid process, which is a bone just beneath the AC joint, and travels medial and inferior, attaching to ribs 3, 4, and 5. When pec minor is dysfunctional, it will cause an anterior tilting of the shoulder blade and may contribute to thoracic outlet syndrome, which is a numbness, tingling, burning, and painful sensation that travels down the arm into the hand. When pec minor is dysfunctional, it will restrict abduction and flexion. To achieve the myofascial release component of this technique, we are going to apply force directly into the pec major and pec minor and the fascia in that area for 1 to 2 minutes. To achieve the ischemic compression component of this technique, we are going to locate tender areas within the pec major and pec minor and then apply direct force into those tender areas through the ball for 20 to 30 seconds. At about 20 to 30 seconds, the pain or discomfort should start to decrease, and at that time, you can move on to the next painful or tender area. And we're looking for about 2 to 4 painful tender areas within the area of the pec major and pec minor. And if we apply continuous direct pressure for 20 to 30 seconds in 2 to 4 tender areas, we should achieve direct compression into the fascia for 1 to 2 minutes. To begin this technique, we are going to take the lacrosse ball and we are going to locate the thick band of muscle and fascia to the outside of the pec major and pec minor. And that's primarily the tissue that we are going to be working into. I'm going to start just beneath the AC joint at the coracoid process where we mentioned that the pec minor attaches to, which is kind of in the depression formed by the shoulder and the chest, right? So we're going to put the ball into the depression right around the coracoid process, and we're going to lean into the wall, trying to find the tender areas. And once we find those tender areas, again, we're just going to lean into them for 20 to 30 seconds. We're going to avoid kind of grinding into those trigger points, as that will increase the inflammation in the area, which will increase the tenderness of that trigger point. To perform the muscle energy component for the pec major and pec minor, we are going to use the wall or doorway to facilitate the stretch and the isometric contraction. So for the pec major, we are going to make a fist and place the thumb side of the fist up against the wall with the arm parallel to the floor. I'm going to step through with the leg that is closest to the side that's being stretched. And I'm going to step through far enough to pull the arm behind the trunk or body, just far enough so that I can feel the stretch. I'm going to hold this stretch for 10 to 20 seconds. At that time, I'm going to lightly, with 15 to 20% of my strength, push the hand and arm into the doorway or wall. I'm going to hold this contraction for 5 to 10 seconds. I'm going to relax and allow that muscle to reset for about 1 second, and then I'm going to lunge slightly further until I feel the new barrier of the stretch. I'm going to hold this new barrier for 10 to 20 seconds. Once the time has elapsed, I'm going to push the hand and arm into the wall again using about 15 to 20% of my strength. And I'm going to hold this contraction for 5 to 10 seconds. Once I've met the time, I'm going to relax, pause for just about a second, and then lunge just a little bit further into the stretch until I reach the new barrier. You want to complete this process 3 to 4 times. So for pec minor, what we are going to do is we're going to take the hand and place the palm against the wall or door frame. And we're going to create about a 45-degree angle from that parallel with the floor. We're going to step through again with the same side leg as the side that we're stretching. And we're going to lunge forward until we get until we feel a stretch, until we reach that first barrier. So we're going to hold this position for 10 to 20 seconds. Once we've reached the time limit, I'm going to push the hand and palm into the wall and hold this contraction for 5 to 10 seconds. Once I've met that time frame, I'm going to relax for 1 second and lunge slightly deeper into the stretch until I reach the new barrier. And we're going to complete that process again another 3 to 4 times. So the last one I'm going to do is an external rotation. So I'm going to take the elbow and bend it to 90 degrees, and then I'm going to take the palm and place it against the doorway or wall. So now I'm just going to rotate medially or laterally so that the arm rotates away from the body until I get to the first barrier. Again, I'm going to hold this stretch for 10 to 20 seconds. Once that time frame has been met, I'm going to internally rotate the arm, pushing the palm into the wall or doorway, and hold that contraction for 5 to 10 seconds. Right, once the time frame has been met, I'm going to relax, pause for a second, and externally rotate until I meet that new barrier. Very important when you're doing these techniques, the stretch doesn't have to be heavy. You're just looking at moving from restriction barrier to restriction barrier. And if you get to a restriction barrier that is painful, you've most likely gone too far.